Hi, my name is Dr. Philip Robb Jr., and I'm a facial plastic surgeon in the Atlanta area. I come to you today as a member of the American Academy of Facial Plastic and Reconstructive Surgery to talk to you a little bit about brow lifts. Brow lifts, as the name implies, talks about and refers to the lifting of the eyebrows. Seemingly simple procedure, it's actually much more complex than many consumers or patients understand. So what I want to do today is just talk a little bit about lifting of the brows, things to consider, and as well as the informational educational process associated with that. One of the things that I think is very important is to trust your face to a facial plastic surgeon. This is all that we do as facial plastic surgeons. So beginning with the general complaint that I hear is my eyes are heavy and I want an eyelid lift or these kind of things. One of the big mistakes that I often see is that other surgeons may not recognize that the brow has fallen, and so they attempt what's called an upper lid blepharoplasty. Well, this procedure, the upper lid blepharoplasty, removes the skin between the eyebrow and the eyelashes. And if the problem stems from a brow that has fallen, then an eyelid blepharoplasty or eyelid lift is not going to be the answer. So the first important thing is a thorough consultation with a facial plastic surgeon. At this consultation, this is an in-person evaluation of your anatomy. We get information about your medical history and whether or not you're a safe candidate for these kinds of procedures. What we do ideally is evaluate how the brow has fallen, if it's fallen, the position, and what our ideal positions are. And so I always tell patients, oftentimes who came in for an eyelid lift, that we actually need to address the eyebrow in addition to the eyelid, because at the bottom of the eyebrow is where the eyelid starts. So naturally, if I bring my eyebrow down here like that, my eyelid skin is going to appear extremely redundant. If I lift it up like this, it's going to appear less redundant. And so that's an important point, is getting the eyebrow in the right position. Well, let's talk about the procedure itself. It's important for you to know that this procedure can be performed with you asleep, or it can be performed awake. And furthermore, there are many different ways of how to perform a brow lift. Let's go over some of those ways now. If we look at this, we're going to start here with number one. This is an incision made right along the superior margin of the eyebrow, and this results in a nice lifting of the brow with not a lot of surgery. This is often done awake. Secondly, we can go in the middle of the brow, in the forehead, usually in a little crease. And then we have various locations within the hair that we can perform this procedure. And in addition to this, there's a procedure called an endoscopic brow lift, which makes small incisions in the hair and elevates the brows that way. Moving on, this is an appearance that we can expect from a brow lift and upper blepharoplasty rejuvenative surgery. Now, this is a patient who's given her consent for her to be filmed here, but as you see, the brows have significantly fallen. They're below the orbital rim, which is not where we want them in a female. And here, we've opened up the eyes by doing an upper eyelid blepharoplasty as well as brow lift. Same picture here. Here's another picture, similar kind of thing. However, with the previous patient, we made the incision right on the upper brow tissue, and that incision is healed well. This patient, her incision to raise her brows was hidden in the hair. And so just another way that we can do this procedure. Oftentimes it's performed awake, as in this procedure. This is a temporal brow lift where the incision is hidden in the hair. And then this is a patient halfway done with a direct brow lift. And so as you can see, the results can be quite nice. And this is us talking. You can see the meticulous surgical technique. This is not a bloody procedure. We're talking about college football in this video. So that's a little bit about brow lifting. The long-term results are outstanding. You will always look better than your previous self if you get a brow lift. And as far as recovery immediately goes, it's several days, all the way up to about 7 to 10 days, depending on how it's done. I hope this has been educational for you. And I'd like to remind you to trust your face to a facial plastic surgeon. If you have more questions or would like to find out more information about the American Academy of Facial Plastic and Reconstructive Surgery, visit our website at www.aafprs.org. Thank you very much for your attention.